we have captioning available, so you should be able to access that on the options bar, either at the, it should be on probably on the bottom of your screen. Everyone will be muted and videos off, so basically you're in participant mode, attendee mode. But when it comes time for questions and answers, we will enable people to ask questions live. We do have the Q&A box open, and so if you have any technical issues and you want to share those questions with us that way, please do. And we do have the chat open, so you feel free to network with one another. And we won't necessarily be like if you do put questions in the chat, we're not going to be answering those while we're having other while folks are presenting, but we can refer to that after. Just a reminder that the chat can be saved by anybody, so it's not actually private. And with that, I want to move into just a little, Rachel's going to do introductions of everybody in a couple minutes, but we just wanted to tell you a little bit about who we are. So I'm Zoe Miller with the, we could go back. Yeah, so I'm Zoe Miller with the Moving Maine Network, and I'm joined here by Heather Drake, who's the coordinator of the network. And Rachel is here from MassMobility. And so we're going to do a short introduction to both Moving Maine and MassMobility. And then I'll turn it over to Rachel, and she will introduce our panelists. And then we'll get to hear from each of them. And then we'll have time for questions and discussion. So we'd love to have you think about what your questions are as you go along. If you want to put them in the Q&A, that's great. So you don't forget them, or if you want to jot them down. And this, as we noted, it will be recorded, and we'll send that link out as soon as we can after the event. So I know there were folks who are excited about getting the recording. So the Moving Maine Network, we are a multi-sector statewide collaborative, and our focus is on ensuring that all Mainers have access to transportation, regardless of their background, their destination, or geography. We do have a special focus on groups that experience barriers, and believe that by focusing on the folks who have the greatest challenges, we make it better for everybody. So our goals are to ensure that Mainers can walk, bike, and roll safely, that Mainers have access to rides, to community, healthcare, and social needs, that Mainers are able to afford transportation, depending on what that looks like for them. And we know it looks different in different, whether you're in a rural setting versus suburban versus urban, and that Mainers have access to public transportation. And again, noting that the modes are going to look a little different. And so we're excited today to be talking about on-demand transportation as one of the modes. Next slide. So Moving Maine, what we do, we support peer learning and professional development for mobility management stakeholders first and foremost. And mobility, there's a few people whose job title is mobility manager, and then there's a lot of people who it's a piece of what they do, whether it's in their job title or not. And so we're knitting all those folks together so they can support each other, share ideas, expand their skills. We also convene stakeholders to spur innovation, to support adoption of new technology, and to inform funding and policy changes. And so, in Maine, where, the legislature is in session. And so one of the roles we're playing as Moving Maine is to note what are the important mobility related bills that are in the legislature. And we're going to be sharing more information on that in May. And we also, finally, we catalyze and support regional mobility management groups that partner to solve mobility challenges. And that's still something that's in formation. And so I know that many of our partners in Maine, or our potential partners in Maine, have been hearing from one of my coworkers, Will Parker, who's reaching out and talking with folks and picking their brains about what's already out there for regional mobility management and what do we wish there was and how does Moving Maine support that. And so to get involved, we're still building our capacity through our steering committee, through our 3 work groups. We also have, we have events quarterly that we call our all network gatherings. The next one of those will be in June. We'd love to have you join us for that. And that's a more informal, we had just under 40 people last time, and it's an opportunity to gain some skills, learn about what's going on, and connect with other folks who are doing that work in Maine. Right now, those are virtual. And you can go to our website at movingmaine.org to sign up for updates and get involved. And so I'm going to turn it over to Rachel.
Thank you, Zoe. Hi, everybody. So I'll add on MassMobility. I'm Rachel Fichtenbaum with MassMobility, which is a statewide initiative in Massachusetts based on the Executive Office of Health and Human Services with the mission of increasing mobility for older adults, people with disabilities, anyone who lacks access to the transportation they need to get around. We do that by going around the state, either in person or currently virtually, learning what different organizations are doing to address mobility challenges, sharing that information with other organizations, and helping organizations think about how they could adapt those innovative or creative or best practices, design their own innovative ideas, and fill in some of the gaps to expand mobility. Some examples of our work: every month we have a newsletter that we email out with highlights of what's new, what's happening around Massachusetts in community transportation. What are different organizations trying, and what are some new funding sources or other resources available to help? We have a website with web pages targeted to riders looking for rides, as well as to human service agencies looking for information on how they can expand mobility for their consumers. From time to time, we put together a report on a topic of interest. So a couple of years ago, my former coworker wrote a report on something very similar to what we're talking about today, for example. And we do presentations, trainings, for example, for aging or disability services staff who want to learn more about how to find transportation for their consumers. So that's a brief introduction to MassMobility. And now we can get into today's topic, on-demand community transportation. I'll give a really quick overview of what we mean when we say on-demand community transportation. And then we have 3 great speakers here today to talk about 3 different examples of how they are implementing on-demand community transportation pilots and programs. So what do we mean when we say on-demand community transportation? I'll break it down into 2 parts. So community transportation, this is a lot of what Zoe was talking about with Moving Maine. We're talking about all local options available to help someone get around their community or get around their region. So not just focused on a specific mode, not just the bus, not just a volunteer driver program, everything that may be available to help someone, and with a specific emphasis on people who lack access to transportation, who cannot just get in a car and drive wherever they want, whenever they want. So with a particular emphasis on access and affordability. And then on demand, by on demand, we mean 2 things. We mean it comes to you. So you don't have to think about, walking a distance, maybe to a bus stop or something like that. It comes to you and it comes right away. So in contrast to more traditional forms of paratransit, where you often have to make a reservation, at least a day, maybe more in advance, on demand means it comes to you in the moment. And so you can think of this like on-demand television. You don't have to, whatever you want to watch when you have time, the on-demand television is there for you on your schedule right away. So in the last 5 or so years, since on-demand became part of the transportation industry, we've seen various examples of different organizations experimenting with incorporating on-demand options into their community transportation programming. And so we've seen a bunch of different models, a diversity of different implementation models. So one of the ways in which those models differ from each other is who's running the program, who's sponsoring the program. So today we're going to hear from a healthcare provider, a municipal government, and a transit authority, each running a program. But in Massachusetts and across the country, we also have examples of nonprofits that have run on-demand community transportation pilots or programs, and regional consortia, groups of organizations getting together to collaborate to create an on-demand community transportation option. Another variable that where different examples differ from each other is who's actually providing the trips. At the point where the rider is getting into the vehicle, who's driving it? What kind of vehicle is it? So one option for on-demand community transportation, some examples use transportation network companies, which is the technical term for companies like Uber or Lyft, where individuals driving their own cars get connected through an app or a platform. So we'll hear today one example of an organization that books directly with a transportation network company, and one that uses a third party. So they're booking through another company, but they're still getting rides in those transportation network company vehicles. A second option is not to use transportation network companies, but instead to use dedicated vehicles with dedicated drivers with a technology component that allows you to offer that on-demand service. So for example, when a municipality or a transit authority uses its own vehicles or a set of dedicated vehicles and drivers to provide on-demand service, instead of using companies like Uber or Lyft, that's called microtransit. And we'll hear an example of microtransit as well today. So now we'll get started with our three presentations. We'll hear from the Maine Medical Center Cancer Institute on how they use Lyft Concierge. We'll hear from the Brookline Council on Aging in Eastern Massachusetts on how they've been using GoGo. And finally, we'll hear from the Franklin Regional Transit Authority in Western Massachusetts on their microtransit program. And so you can, as Zoe said, at any point, you can put questions in the Q&A box, but we will get to the questions and address them at the end after the three presentations. So with that, I'm excited to welcome Magda Alden of the Maine Medical Center Cancer Institute. Welcome, Magda.
Hi there, thank you so much for having me. So my name is Magda. As Rachel said, I am an oncology social worker with Maine Medical Center Cancer Institute. We serve you can stay on that slide, that's fine. We serve the entire state of Maine and part of New Hampshire. So like the Conway, a little bit south of there, that whole region that doesn't have Maine medical care, they come all the way to us as well. So pretty much we have patients from all over, but the part that I'm going to be talking about is using Lyft Concierge and really focused on the Cumberland County area, which is highlighted in this map right here. And I really wanted to kind of demonstrate how it's kind of we have an urban community within the Portland area, and then it goes very rural very quickly. So from Portland to, I think what's really classified as rural is really Gorham, where I live, and that's a 10-15 minute drive to be able to get to a rural area. And maybe a little bit further too, but it's basically within 20 minutes you go from urban to rural very quickly. So we don't have a lot of drivers out in those other areas. Most of the drivers are in the Portland area. And this map, which I kind of, on the right-hand side, I kind of wish I carried it through the entire presentation just to kind of show you. Where I'm located right now is where the pickup in 27 minutes is, and that there's one driver that I could see in the entire map for our area at this time. And I'm gonna go over that a little bit more, but basically we don't have a lot of drivers in the area, but I'm going to go into for a lot more detail. So I guess next slide, I'll start there. So the background for our situation was really the fact that I work with cancer patients, and transportation is one of their largest barriers. we identify it in a significant number of the patients we treat, that they have trouble getting to screenings, getting to their appointments. Then once they get diagnosed with cancer, it's the ongoing appointments. So chemo, radiation, surgery, all of that are significant barriers to our patients. And we have limited transportation resources in the area. I could probably do, if I wasn't asked to have just done Lyft, I could have done an entire presentation just on the limited resources that we have for our cancer patients in regards to transportation. But basically, this is why we kind of went with Lyft to try to focus on this. The transportation throughout the state that we have that is available for our cancer patients, most of it is grant funded. The funds run out very quickly, especially in areas where there's long distances that the patients have to drive. And also they might not, you have to plan ahead and book out days to weeks in advance for some of these organizations. Next slide, please. So very wordy slide, but basically this was kind of like the summary of our grant. So it's a 2-year pilot project. We received funding from an organization called Maine Cancer Foundation that provided us a grant to be able to try Lyft Concierge. The goal was to identify patients that were receiving care in Cumberland County who either might not have insurance coverage through insurance that might be able to assist with transportation or need last minute rides. We're hoping that it would help our patients get to their appointments, that they wouldn't miss their appointments, and we'd maybe have patients that are more satisfied depending on, you know, patient satisfaction scores, but that really doesn't, I don't know how that really correlates, but it's, people get grumpy regardless of what we have sometimes, so it doesn't really matter. But so that's how we kind of structured it. We chose Lyft Concierge. We talked to several, we talked to Uber Health, Lyft Concierge, and then we researched Circulation Health, which to my understanding is really just kind of a third-party broker that uses Lyft and Uber to kind of book these transportation companies. And we went with Lyft. I figured that honestly, most drivers I think are out there use Uber and Lyft, so they have both contracts sometimes. So I figured maybe we'll just go with one. So next slide, please. So the goal was to use this as a backup transportation resource. So we're going to try, you know, our Medicaid program offers transportation to certain patients. So using that for those patients, a couple of other insurance companies, Medicare-based programs might have a transportation program. There's community transportation programs as well that do have grant funding. And then we did have ACS Road to Recovery as well, which was volunteer driver programs. And with the pandemic, that has kind of been sidelined. But that was kind of our goal, was to use the volunteers and other programs first. We kind of identified different things that would help us trigger what the patients, which patients would use it. So if the ride didn't show and they needed to get home, if they had a lot of appointments they needed to coordinate between, and our transportation program wasn't, like if they used Logistic Care or Motive Care, whatever they're called now, our main care transportation broker company, there's like a 30 to 45 minute window to be able to pick up these patients. And so if the appointments overlapped and were too close together, we thought maybe it would be easier to try to use a different program. If the patient's too sick and can't wait for their ride home, if the clinic is closing or the patient needs to go home, or if it's really the right thing to do, if we find that our patient needs to have, if the transportation they were using stresses them out, if they have other issues that might impact their ability to use transportation, we're just going to try to use this Lyft program. Next slide, please. So we implemented it during the pandemic, which was interesting. So we started around May of this past year. If I was able to count the statistics right, which is really hard to kind of pull all this information, we had about 120 Lyft rides completed from when I did the math a couple of weeks ago. I've used it a bunch since. We had at that point 17 rider no-shows, which honestly, that's a really interesting thing that the driver marks the driver as a no-show, but I've had patients be like, I've been waiting outside, I never saw the driver, whatever the case may be. Lots of coordination issues there. 8 no drivers available, which has increased exponentially since I pulled that statistics. There's not a lot of drivers in the area, and we tried for like 2 hours the other day to get a driver. So I had multiple no driver available stats that got pulled that day. 4 canceled by driver, and 1 that was citing health safety concerns. We saw that around the pandemic, drivers didn't want to go near the medical centers. They weren't picking up those rides. 1 saw that it was driving towards the hospital, saw that they were going to the hospital and dropped the ride at that point. And then we had 15 trips that were canceled by the agents, which are myself and my colleagues, for a variety of reasons. A couple of them were, we, waited to see if we could find a driver and couldn't find the drivers, and ended up calling for a taxi to see if we could get the patient where we needed to go. One of them, or more than one, where we saw the driver was circling the map up in like a different area, or like driving away from the patient when we were like, no, you need to go that way, and we get confused. I've since learned that the patient can, or the driver can pick up a ride and still have another person in the car and be driving that person, but then going to pick up our driver. So I've seen them like drive past on the map. I've seen them drive past our patients or like away, and they're like all around the map, and we're like, what's going on? Why aren't they picking up our patients? And we freaked out and canceled it. So I've since talked to our driver in the last week and kind of figured out that's what's happening. It would have been helpful to know, trying to understand how the system really works. But it was stressful to see the patient, like the car come down off the ramp and go right past our patient, and he's like, what's going on? So anyway, we've used 30 taxi rides to supplement what Lyft could not meet at that time. And I can go into that a little bit more detail in the next slide. So like I said, we launched it in May of 2020 with mixed reviews. What's worked well is that for certain patients, it's really been able to alleviate transportation distress. Very particular patients, it's been able to do so. The challenges, which are the majority of what I have to talk about, is that we have a lack of drivers in the area, especially in the pandemic. We had an average of maybe 2 or 3 that I saw on the map at one time. That was on a good day. On a bad day, we never saw a driver on a map. The other day I pulled it up and there was like 5 drivers, and people must be getting out there a little bit more, but that just happened to be at a random time. So there's not a lot of drivers that have been available to be able to use, for us to use it at certain times. The drivers canceled the rides. I kind of talked about that briefly. There's a lot of obviously concerns about COVID and exposure, and I don't know if they're pulling up and seeing the patient doesn't look well, and they're worried about exposure and canceling the ride, or potentially going to the hospital, or whatever the case may be. But we've had a couple of them where it's been frustrating and they've been canceled. The majority though is the patients get confused and they're unable to use this system. So it's been really hard to, like, I basically talk to our patients and I'm like, have you ever used Uber or Lyft? Do you know what it is? And then we start in with, do you have a cell phone? Do you have this? Do you have that? What can you use? Can I walk you through how to use this? And then it gets complicated with them trying to understand who their driver is. Patients who are elderly or might not speak, English as a first language, or don't know how to use a cell phone. We've had a lot of struggles with this, and we've had some really confused patients that get treatment up at the hospital. We're at a satellite location, and the hospital has one of the radiation sites, and it's down in the basement. It's very confusing to get to. And then if I call them for a ride They don't get cell phone reception down there. So then we're getting them back up to the main level and then trying in this massive area to find their ride with limited staff that have the ability to go outside and help these patients. So it has been difficult to try to coordinate these patients getting the rides, especially at this one location. A little bit easier here because I'm on site here and I can be available if need be and try to help our patients, but I serve 7 sites. And so I'm not everywhere where our patients are. Another big challenging one, and which we would have never been able to predict, was our patients have to go for testing, COVID testing prior to surgery, prior to starting chemo and starting radiation. And I can't use it for those trips because it has to have I can't do multi-leg trips. So I can't have them pull through the testing site, get swabbed, and then go back home again. So I have to use other transportation options for that. And multi-leg trips are fine if it's getting out of a vehicle, going in, and then I order them a second vehicle to go somewhere else, but not if they have to run in and grab something and then run back out again. It just doesn't work like that. So that's been a huge barrier. Another significant struggle is that one of us has to kind of monitor the rides. So if there's no driver available, or just in terms of helping the patient find a ride, I have to be on the screen and I have to be looking at that and being like, okay, your rider's here, and you need to go outside and meet them, especially with the people that might not understand how their cell phones work. So that's been an issue. And then when the ride when there's no driver available, it doesn't 100% notify or do a pop-up or anything like that. So I have to literally keep going back to the screen and checking, okay, there's no driver available. What are our next options? Am I going to try again and see if I can get another driver? Or am I going to try to go and find a taxi? And then communication barriers. Patients don't speak English. If they have a cognitive impairment that might make it difficult to understand the process. Those have all been significant barriers for us with trying to navigate the system, just in terms of communication, working cell phone, whatever the case may be. The nice thing is if they don't have a cell phone or if they don't have a cell phone and they have a landline, I can get the information. It will either pop up on my screen or I'll get a phone call saying, hey, this is the ride information. And then I can call the patient and I can give that to the patient on their home phone number. But that's a multi-step process, which is great. That's one of the reasons why we wanted to implement this system, was that we could have control of some of this, but it's also hugely labor intensive. Next slide, please. So we've made some revisions and tweaks since we first launched it, which was we lost some of our transportation resources. So I can't rely on our ACS Road to Recovery program at this point, and to be able to be our primary source. So this really has kind of been our go-to resource. And I've had to use taxis for a lot of our rides as well. So certain patients who we tried Lyft, it failed. We had to go and use taxis for the rest of the trips. And then obviously if we can't get a driver through Lyft, we have to go to a taxi. But honestly, I looked for, when I was talking about the other day where we tried multiple times to get a ride home through Lyft, I also called a taxi company at the same time, and there was a 2-hour wait. And we only really have one taxi company in this area. So I don't have a lot of options. There might be a smaller one, but I'm only familiar with one taxi company at this point that we have a contract with that will do our billing for us. Speaking of billing, one of the things that I meant to mention is that we're paying with our grant for these rides. So our patients are not paying for them. This is completely, the grant is paying for these patients to get their transportation. And again, one of the other things that has been nice is, so I have used this to maybe supplement until we get other transportation up. So we have a regional transportation program in the Cumberland County area that I can get some patients to qualify for. So I did, a couple weeks ago, I used Lyft for a week for this one individual who was 100% capable of figuring all of this out, and used it for his radiation for the first week, and then got him applied for, and we got the application expedited, and he could use RTP for the rest of his rides, which was great because, you know, he was able to book it and deal with all of this. And thinking about that, so our patients get daily radiation. For this guy, I had to go on every single day and book his rides. I could have probably booked out a couple of days, but I needed to monitor these rides too to make sure he got picked up. On the way home, what I did was send him, because again, he was a little bit more capable than most of our patients. I sent him a flexible link, which he could click on once he was done with his treatment, and request a ride on his own time, so that I didn't have to calculate out and estimate any hiccups with his treatment. He could say, I'm done now, and he could request his ride. He's the only person in the last year that I have been able to utilize the flexible link successfully. So I've done that with like 3 other patients. They've deleted their text messages. They don't understand how to use it. All of those things. It's a great option. It just has not really worked for most of my patients. And so another thing is just like a summary is that Lyft has just not been the best for every single rider. We have to kind of evaluate what is their, you know, what's going to be best for them. Next slide, please. So knowing your audience is really what's important, I guess. That's kind of my biggest takeaway. Will they understand how Lyft works? Are they able to locate the vehicle and or ask for help from somebody else to be able to help them get into their ride? Can they use the flexible ride option? I've only had it used successfully once, so there's that. Mobility, can they get in and out of a vehicle by themselves? Do they need assistance to ambulate? If so, Lyft isn't going to be their best option. You know, I don't know very many Lyft drivers that are going to get out and help a person fold their walker. So I'm not going to send somebody that has a walker in a Lyft ride, which is a good portion of our patients. Are they able to advocate for themselves? Are there any communication barriers or language barriers that might affect their ability to like call and say, hey, I'm lost? You know, a couple of patients that just will wander around aimlessly and never get to their treatments. How prolific is Lyft in your service area? Is it going to be used? So in like our area, I was like, great, we're in kind of a suburban or urban area. We should be able to utilize this a lot more. Hasn't really been the option. I'm not going to, I can get a patient picked up here a lot easier than I can at their own home a lot of times, especially if they're kind of in a little bit more of a less urban setting. And the nice thing is I can schedule rides in advance. So I kind of said that as a I can schedule certain rides in advance, but I can't, you know, if anything changes with those rides, I have to kind of be monitoring them and all of that. So it's a positive, but it's also kind of a complicated thing. But yes, I can schedule out some of those rides. Next slide, please. I guess that's the end of my presentation.
Great. Thank you so much, Magda. That was great. Thanks for sharing your experience using Lyft Concierge. And so feel free, if you think of more questions for Magda, feel free to keep putting them in the Q&A box or make a note for yourself, because we will have the Q&A with all presenters at the end of the presentation. So now I'm excited to welcome our second presenter, Maria Foster from TRIPS in Brookline, Massachusetts.
Hi, everyone. So I'm Maria. I work for the Brookline Council on Aging as the community outreach specialist. Although I've sort of embraced Rachel's moniker that I am a mobility manager. So Rachel, if you want to go to the next slide. TRIPS is a program that was started originally to sort of bridge the time between when an older adult was moving from sort of driving to non-driving options. And we offer sort of 3 main things. I work with a small group of volunteers, older adult volunteers who are all sort of passionate about transportation. And we developed a transportation resource and information guide for specifically the Brookline area. We do provide some outreach, education, and training. One of the most significant things that we've seen is this sort of transition to sort of technology-based apps to request transportation, and sort of trying to address that technology gap since about 2016. We've offered training directly to older adults on how to use Uber and Lyft through classes, and also through the development of a small brochure, which you can see here, called Ready, Set, Ride, Hail. That's step-by-step directions for how to use the Lyft app. In addition to that, we also provide peer-to-peer and individual support for older adults who are looking for transportation options. As I said, we're located in Brookline, Massachusetts, which is sort of an urban/suburban town. We are surrounded by Boston, so we have a pretty transportation-rich area. Yeah, great. Thanks, Rachel. So some of the examples of programming and projects that we've done in the past is transportation resource fairs, which were held in conjunction with helping older adults get their senior Charlie card to use on the MBTA here. Just general transportation information resource sharing for older adults. We just did a Zoom drop-in session about transportation in the area. And in the past, pre-COVID, we've done trips on the MBTA. And then again, as I said, we've done training for older adults, both here in Brookline and at other councils on aging in the area on how to use Uber and Lyft. But I'm here to talk about, we also support the town of Brookline on 2 new programs that offer transportation discounts to qualified older adults. One is on Lyft, and the other is on GoGo. You want to go to the next slide, Rachel? So the issue was that Brookline had for a very long time, the last 30 years, a taxi discount coupon program for older adults to travel within Brookline, which was targeted to low to moderate income older adults and funded through a community development block grant. So we sort of recognized that we would need new options because of the increase of Uber and Lyft vehicles in the area. And we went from a significant number of cabs that were able to dispatch in Brookline to about 15 at the beginning of the pandemic. In September of 2019, so pre-COVID, we were able to implement a pilot program with Lyft to offer discounts to qualified older adults, so low to moderate income, by securing a grant through Lyft and the National Council on Aging. So we started that program in September of 2019 with a pilot group of about 25. And we were able to sort of continue that program by securing funding from the town of Brookline, receives a small tax on each Uber and Lyft ride that comes back to the municipality. And so we were able to receive some of that funding to support continuation of this Lyft program. So the Lyft program and the taxi discount program were sort of running concurrently because we did recognize that folks still needed the option of not having to use a smartphone. So you can go to the next slide, Rachel. What we found was that during the pandemic, the last remaining taxi dispatch company went out of business in Brookline. And so the pandemic really necessitated us to look at this new option of GoGo, which actually provides dispatch for Uber and Lyft vehicles. So GoGo was a group that we knew about because they had won a Mass Health Connector Challenge grant. Rachel probably knows more about that than I do, but so they had won this grant and had done a really interesting presentation to a group of organizations in Massachusetts. So we were familiar with them. We knew that they worked with other towns and organizations to provide this type of service, and that they were pretty flexible in how they could work with us on providing these types of discounts. So the program was actually modeled after our Lyft program. So older adults in town receive access to 4 discounted rides per month. But GoGo offers those folks who don't have access to a smartphone and can't access the Lyft app the ability to get those on-demand rides. You want to go to the next slide, Rachel? So yeah, as I said, they get access to those 4 discounted rides. It is a little bit more limited geographically. So with the Lyft program, folks could kind of go anywhere. With the GoGo program, so GoGo charges the flat rate of the ride, so the Uber or Lyft ride, but then there is a small surcharge on top of that, depending on the time and distance that you go. And so because of that, we had to sort of limit this program a bit more. So it is only available within Brookline and then to some select medical areas. It goes pretty far from us. So it goes all the way down to Mass General Hospital, so down in the middle of the city. But we are still targeting low to moderate income older adults with this program. You can go to the next slide. So these are sort of positives and negatives. So it was pretty easy to implement the program administratively with GoGo. I think, we had this Lyft program already established, so I sort of had an understanding of how that process worked. And then GoGo actually offers full support to users. So they're able to sort of deal with the missed connections that Magda was talking about earlier, which does take the burden off of staff to have to do. They also will negotiate with drivers. So if there is somebody that has, a roll leader or something, they will actually contact drivers to make sure that they're willing to, help a rider with their roll leader. So, I think that's definitely a positive. I mean, we are also seeing sort of a significant decline in the number of drivers that are available. So that definitely has been a challenge with this program. We also use Lyft Concierge separately for some of the last minute needs that Magda was talking about, and have seen similar issues with drivers. So some of the other challenges is that the pandemic, I think, has made rider conversion challenging. I mean, most of the folks that utilize this program are the oldest and most frail. They don't have access to a smartphone. There is often a language barrier. So I think, having that sort of face-to-face conversation with somebody about how the process works, I think would be a significant benefit, and we just haven't been able to do that because of COVID. So that's all I have.
Excellent. Thank you so much, Maria. That was great. Great to hear about your program and similarities and differences with what Magda was talking about. So thank you. And again, keep putting any questions you might have in the Q&A box. We'll have the Q&A with all presenters after our next presentation. So Now I'm delighted to welcome Tina Cody from the Franklin Regional Transit Authority to talk about her microtransit program. Welcome, Tina. Oh, Tina, you're muted. There you go.
Can you hear me? Okay, perfect. So thanks for having me. I'm going to try to get through this, although my allergies are really kicking my butt right now. So if you want to go through the next slide, so Rachel, I'm sorry. So the FRTA is one of 3 rural transit authorities in the Commonwealth of Massachusetts. Geographically, we're the largest transit authority, spanning over 1,100 square miles. We have 41 communities, so very rural. One of the issues that we were noticing was that we had a lot of empty seats on our demand response vehicles, and there was an opportunity for us to fill some of those seats and potentially, you know, increase our revenues, but also provide services to those who might be in more dire need. Those vans were put aside for the elderly and disabled, so there really wasn't any programs for the general public outside of fixed routes. So, you know, some of our fixed routes have long run times. There's infrequent service. Like the first presenter, there's little to no taxi service. There's no Uber or Lyft in our area. I think we may be up to 2 taxi services in our town, but they don't have any handicap accessibility. So there was also an issue when we were looking for that as well. Next slide. So we were given an opportunity to file for some discretionary funds through the state of Massachusetts, and we had a platform already in place to schedule our ADA and demand response transportation. So this was another add-on that we thought would be worthwhile looking into, and therefore we created this pilot project. And we were then able to open it up to the general public and also our current consumers. Again, it uses the capacity on our demand response vehicles. It's on a first come, first served basis. And it was using a self-scheduling mobile application to start with, which is something that we did not have before. In our rural areas, as you know, there's oftentimes little to no internet service, cell phone service is kind of spotty. There are a lot of challenges that we have when it comes to this mobile platform, but we decided to give it a try with one of our more populated towns. Next slide. So we launched the FRTA Access back in October of 2019. We started with 2 zones, which were our more populated zones, you know, more population, still rural towns, but these were towns that we already had fixed route service going to. Therefore, the platform was already there in terms of our drivers knowing how to use the tablets and how to connect with the platform that we were introducing to them. Initially, when we started, there was no travel between the 2 zones. We, again, were just trying to figure out and carve our way into what would work and not knowing how successful that would be. We started out by offering $5 for each one-way trip. And again, we tried to make that more than the ADA trips so that there wasn't an unfair advantage to the ADA consumer, but also we wanted it to be less expensive than the taxi services that were in town. You know, we had some challenges, but by March of 2020, we expanded the hours. Initially, I think they were from 9 to 4, and then we expanded them, I believe, from 6:30 in the morning till 7 o'clock, which for us also was an add-on for our fixed routes because we did have some of our fixed routes that weren't operating that late into the evening. So we started seeing a trend of upward ridership. Everything was going really great. Then COVID hit, which the nice thing about the microtransit was when COVID hit, we ended up reducing some of our fixed route service because of it not being used. The ridership had gone down, obviously, with COVID being on everybody's mind. So this was also a way for us to fill in the gap. So for instance, if we had a 4 a.m. fixed route bus that was no longer operating due to low ridership, we then filled that service in by allowing the general public to schedule a ride through the Access program. So they still had a way to get into work. It didn't cost them any more. We charged them the same amount that the fixed route would cost. And it really, we started seeing an upward trend, even with COVID hitting. of how this program was being utilized. Next slide. So we expanded service after, I believe it was March. We then reduced the price. We felt that $5 may have been a little steep, especially during COVID. So we reduced the price, and I believe we went to $3 for every one-way trip. And that was the same as our ADA price points. Every additional rider was $1.50. So we were trying to incentivize persons using this service and bringing multiple persons with them, whether it was children, a family member, somebody that could assist them with other, you know, assistance that they might need, whether it was grocery shopping, medical appointments, that sort of thing. We also expanded it into 2 more additional zones. So then we had 4 zones that were a little bit less populated, but again, within our fixed route, so that our management company was still able to utilize the vehicles that we had. And again, we're not outsourcing this with a third party. We're doing this with our management team. In Massachusetts, the RTAs cannot hire their own drivers. We have to contract with a management company. So in this case, that actually worked for us in terms of us being able to hire additional drivers that were non-CDL licensed, which was a little bit cheaper for us. And we also had, you know, some smaller vehicles that we were able to fill more seats in. We then extended it so that you could travel within the zones. That was a little bit more money. There was, you know, I think it went from $3 to $4. So they were now able to travel within zones, which did help. You know, Orange, say to Athol, not that far away from each other, but initially we weren't able to travel outside of those 2 zones. And now they can schedule using the mobile app, which is initially how we set this up. And then, you know, we were hearing a lot from individuals that they didn't have a mobile phone or a smartphone. It was confusing. We then started off where we allowed them to use a web portal, whether it was an iPad, a computer. They were able to then use a different platform other than just their mobile phone. Next slide. More recently, back in February, we decided to try our luck with weekend service. Massachusetts, most of the RTAs have some form of weekend service, whether it's just Saturday, some of it is Saturday and Sunday. FRTA has not had any weekend service since 2005. So we launched this in hopes of getting an idea of where people would want to travel to. It's going to be able to provide some data for us in terms of the times people are using this, where they want to go, and that sort of kind of will lead us into the next step of potentially asking the state for additional money so we can make this more of a permanent thing. You know, the good thing with pilot programs is that you learn from them. We can start out small and kind of amp our way up to what people are asking for and get feedback and provide something than what we originally thought would work. So again, we have this grant now through 2022. So we're hoping that we can build up the ridership enough to show the state and to prove to our legislators that this is something that everybody wants and that we can make this, again, more permanent so that people are not having to call their rides in or schedule it through a mobile app, and they can just rely on the fixed routes coming to pick them up. Next slide. So these are some of the bigger ones. I would, you know, anybody looking to start the microtransit process, be extremely patient. I think when we started with the community and when we started with the software system that we had, they were telling us 2 months. We can have you up and running in 2 months. That was not the case. So do expect some delays, definitely expect some setbacks. Do your research prior to purchasing your software. In our case, we already had the software company doing some work for us, so we were familiar with them. We had already developed a good rapport with them. But definitely dig into what the purchase price is. A lot of it seems really good right off the cuff because we did go out and get some pricing for other platforms, but you know, there might be a fee for each license. There might be monthly or annual fees that are hidden. So initially it might be good. They might give you that break for the first year, but going into year 2, 3, or maybe even 4 and 5, those costs are really going to double or triple in some instances. Definitely let the software provider know what it is that you're trying to accomplish, and let them know what it is that you're trying to put out there into the community, so that they can, one, make sure that it's something they can provide, and two, if not, it's something that they can try to work toward and help you find a solution for. Every service area is definitely unique. Expect to modify these several times prior to launching the service. Next slide, Rachel. One of the big things for us, and something that was really successful for us, is it gave us a lot of time to do adequate testing. We utilized some of our employees that were within the area that could access this platform. So we also reached out to some of our regular riders and to some individuals, like we like to call newbies, that maybe have never used, an Uber or a Lyft or anything along those lines, so that we could get an idea as to whether or not it was challenging for them, if there were changes they'd like to see. It's sometimes hard to listen to the criticism that they have and then build from it. One of the issues we had, for instance, somebody waiting at the local Big Y for their ride. With this platform, you have to put in the address of Big Y. Most people don't know what the addresses are. It's just a landmark. It's just, I'm at Big Y, come get me. So one of the things we did was kind of took, if everybody's familiar with the Waze, when you start typing an address in, it would automatically pull that up. So what we did was we went in and put points of interest in along our routes, so that if somebody put in Big Y, it would give you an option to choose the address in Greenfield or Northampton, that sort of thing. So it made it much more user-friendly. And again, we have made several changes to our fares. We've made several changes to our schedules. And then there are things that happen, like unexpected pandemics. So develop your marketing strategy, be vigilant with it. Again, that part has been a little bit more challenging for us just because of COVID hitting. Obviously, ridership is down across the board for everything. So it's hard to tell what has worked and what could have worked better. We've recently started to do some radio ads. We've applied for another grant to do a marketing outreach process and program. So hopefully that will produce some more riders. But, when you think that the majority of people know about it is when you find out that's not necessarily the case. And that is something, with the COVID vaccines coming out and with COVID testing, that we were made aware of. A lot of people were calling, looking for rides. They just weren't familiar with the programs we had, and especially with the Access program, because it was new. Next slide. If you have any questions or you need any more information, we do have this up on our website. Although, if there's more information or if you have a particular question, we'd be more than happy to answer that. And again, I would say we've had about 25% of the people that have downloaded the application have used it. We have created a survey recently that when a person schedules a trip with us, the survey automatically goes out, or I shouldn't say when they schedule a trip, it goes out when they schedule a trip, but also when they sign up. They can go in. We have a lot of people that have signed up for the Access program, but have not necessarily started using it. So we're trying to get some feedback as to whether or not it's because of COVID, if it's because they've lost their job, if it's too complicated to use. So again, it's a constant learning process for us, and we're always trying to find ways on improving this. And hopefully when the pilot phase is done, we'll be able to find some permanent funding and make this an actual part of our system. That's all I have.
Thank you so much, Tina. It's such a creative program. Thank you so much for taking the time to share it with us today. So now I'm excited to introduce Heather Drake from Moving Maine to start the Q&A.
Thank you so much, Rachel, and thank you to all of our panelists. This has been a great presentation, and we really appreciate you being with us this morning. We have a lot of great questions coming in. One that I'll take first, it's open to everybody. With everything that you've all learned about apps and technology challenges, would any of you recommend going to a telephone-based service? Is it too cost prohibitive? Are there other challenges? have you even considered it as an option?
Are you talking telephone-based, like a call center?
I believe so, yes.
Sorry, I'm trying to get my video on. We looked at it. One of the reasons that we went with this mobile platform is because one, it's a self-serving scheduling process, but also people can cancel, they can schedule, they can do everything on their own. We didn't feel at the time, because we're a smaller agency, that we had a call center big enough to deal with the influx of calls that we would potentially be getting. So we did start out by using this platform, but there may be times down the road, if we expand our program into some of the areas that are definitely more rural, that we might have to expand our call center, since there isn't a lot of cell phone service in some of those outlying areas.
I mean, I would just say that, I mean, I think that with the GoGo program, that is what we were trying to sort of emulate, was the ability of somebody being able to just call a cab. I mean, they have operators available 24/7. And so, you know, I think, but, and just with the challenges of actually finding a cab here, and sort of the decline in quality, you know, that's definitely what we're sort of trying to emulate with the GoGo program. Although I think somebody else asked if you can use it with a regular cell phone or a smartphone, and you can definitely use it with a smartphone.
I don't know how a telephone-based system would work for me with like Lyft or anything like that. I don't know. We utilize so many different transportation programs. I'm on the phone a lot with the different ones, so I'm the telephone system, I guess. I have a lot of other things to do.
Yes, understandable. Thank you. For those of you who are using taxi companies, or who have considered using them, have you thought about negotiating with them in any way so that they might prioritize your rides to ensure that there are rides available?
So I meant to mention that we had more than one taxi company before the pandemic, and now I believe we're really down to one. We talk to the taxi company a lot, but there's a lot of people that need it prioritized. So they understand that we need, you know, to get our patients where we need to get them, but they just don't physically have drivers to be able to meet those needs. So it's really, you know, as much as I can talk to somebody, you know, if they don't have a driver available when I need it, it's not going to like make a difference at this point.
So we actually just received a small grant to work with a local taxi company to specifically provide medical transportation, like non-emergency medical transportation. And so we will be doing that, but you do have to request those rides in advance. So they're not on demand. But I think that's the way to get around that, so that you can get a prioritized ride. And we're specifically using those for medical transportation.
Thank you both. We've had a few questions come through about tipping, and how do you handle that? Do drivers demand it? Do you think if you are able to offer tips that you would have more drivers willing to participate?
Our drivers, yeah.
Sorry. Do you want to go, Tina?
I was just going to say, our drivers, because we're a transit authority, they're unable to collect tips. So that's easy for us, but I'm sure in your, you know, with the Uber and Lyft, that probably would be a different story.
So I've really wondered about that. I probably should ask Lyft what actually happens and if these drivers get compensated at all. I'm also curious because I do think that it shows up differently when we're using Lyft Concierge. I think it identifies like certain drivers don't accept Lyft Concierge is my guess, because when I pull up Lyft on my own phone, there's different drivers that are available than I can see on the screen. So I think that they might have different contracts based on what they're expecting. I did have a patient the other day give a driver money to go buy a coffee, which was very nice of him, and he shouldn't have done that technically, but I mean, he could have, but I don't think that, I honestly don't have an answer because I have just started thinking about that recently and wondering how that works and try to ignore it because I don't have an option to tip. So I don't know.
So with GoGo, it's sort of interesting because I think there isn't a way to tip. And often older adults will ask me. I think generally with Uber and Lyft, they prefer that you tip in the app itself. But you know, I definitely tell our riders, you know, if they feel like the service is above and beyond, that they can tip in cash if they're using GoGo. And then if folks are on the regular app system, we definitely talk about how to tip in the app.
Thank you all for taking that question. And I do want to let folks know that if you aren't able to type in the chat, you can use the raise hand feature, or if you're calling in on the phone, if you dial *9, you'll be able to ask a question.
I did think of something really quickly, Heather, that I forgot to mention. Another issue that we have had with Lyft has been that rides have been completed when the patient is actually not in the vehicle. And so we've had to complain about a significant handful of times that a driver has said they've done the job and they haven't. So I've seen that with both this and with like Lyft used in other programs as well.
Thank you for adding that in. It does look like we have a question from the audience. Travis, you should be able to ask your question now.
Hi, can you hear me?
Yes.
Hi, so I think actually Brookline may have already touched on this. So Travis Pollock, I'm with MAPC, and you know, we do the taxi grants, and I think both FRTA and Brookline, you know, you received grants to work with taxi companies. I'm curious, just maybe if you could touch on that, like when you see the taxi program as being a tool versus maybe the microtransit or the Lyft program or working with GoGo, and just the kind of the different ways that you were thinking of the different programs and where they fit in.
I can start. For us, I don't know if we are looking currently at potentially using some of the two taxi cab companies in our area to work with us on a grant for second and third shift employment opportunities. Right now, again, none of our taxi services, there are two, they're very small, they're not handicap accessible. You know, they're localized in one town in Greenfield, but we are looking to potentially use them for second and third shift employment trips. But during the hours, you know, 6:30 to 7:30 at night, right now, we are using the microtransit model. And again, in that microtransit model, you can do same day, next day, schedule up to a week in advance. So we are looking, you know, at using some of the taxi services in the future, but again, that's going to be new for us because we haven't contracted with them for any localized work.
So what's happened for us is that we have these two discounted programs that we're currently running, but during the pandemic, we actually have been utilizing the senior center van and bus to provide medical transportation, specifically from in and amongst Brookline and then to the Longwood medical area. And I'm expecting that at some point we will return the van and the bus to sort of their regular service, which was getting folks back and forth to the senior center. And so we wanted a way to still provide that medical transportation, especially for folks that, you know, I think Magda touched on, that are not able to use Lyft and Uber, and even GoGo may not be the best option for them, but they could still get to and from medical appointments. the other thing is just vaccine transportation. I think it would be really nice to be able to say to folks, hey, you know, here's a free taxi ride to a vaccine appointment. So that's what we're sort of looking towards.
I don't know if this will answer your question or not, but like, I'll just kind of give a scenario of something that I had to think through today. I have a patient that needs to be at the hospital for a procedure by 6:30 later this week in the morning. And I'm not going to send Lyft to try, and like, if we don't have a driver available, nobody's going to be problem solving that. I mean, I could at 6 o'clock in the morning, but I'd prefer not to be. And technically I shouldn't be, because I try to keep boundaries with my work. I've done that a few times, but I'm not. Anyway, so, and I'm not using our main care transportation benefit for her either, because I called them. They're probably going to be using Lyft at 6 o'clock in the morning to pick her up, and nobody's monitoring that. So I will be using a taxi, which she will have the phone number for, to be able to call if they don't show up, and she can take out her anger on them, which she's not. She's a very pleasant person, but she wants to get her procedure done. So she can call and advocate at 6:30 whenever she doesn't get picked up, that she needs to be somewhere. And I can give her that power to do that. And hopefully that's going to be the most successful for that time. And that's kind of what I think about when I think about every single patient, is what's going to work best for them. Where are they going? How are they going to access something? What of all of our transportation options can we use? And if they are in a wheelchair, we're completely out of luck. So that's basically a long summary.
Thank you all. And this question is specific to Tina. How did you all acquire your software package for running microtransit? And also to you, Unrelated, what's your current volume of rides?
We had, we're using EcoLane software. We had them in place already, like I mentioned earlier, for our ADA transportation and our demand response transportation. So it kind of made sense for us to stick with them, only because we were already familiar with the ins and outs of all of that. So, you know, we did go ahead and purchase software from them as an add-on benefit. And one of the nice things about that was we already had the licenses purchased for the vehicles. We already had the annual maintenance fees and those sort of things. So a lot of the costs that would have potentially been extra for us with going to another company were already kind of packaged in with the software company anyhow. So with that, and then the ridership started out really well. Unfortunately, I'm working from home today. I don't have the numbers right in front of me, but it started out really well, and then COVID hit. So that obviously diminished a lot of our numbers. We're starting to see an uptick again with that now that we were providing weekend service. And a lot of the weekend rides that we're seeing are for people having to get back and forth to work. So that was a little bit surprising for us. We thought maybe they'd be using that for more, you know, things like grocery shopping and going to movies or visiting friends. And it's really been more of an employee-based service for right now.
Can I just ask a follow-up question? So the software that you're using, did you just put it on the regular vehicles that you had already had? Did you acquire new vehicles for this?
No, all of the vehicles were already outfitted with the tablets and with the GPS and the AVLs and everything. So we didn't really have anything there additional to buy. As the program grows, we might need to obviously buy more tablets and get more vehicles. We have had to hire more drivers just to help with, obviously with COVID, the vaccines, especially lately, and the doses that we're doing and testing. That's kind of, we've seen an uptick in that as well, but we're still not up to where we're probably at maybe 75% of our ridership on fixed route, and with the demand response, we're probably at maybe 50 or 60%. So we're still behind, but this has definitely helped.
Thank you. And staying on the software conversation, as you all did your research on what software to use to help folks, you know, get ahead of the game, were there software companies that you decided not to use?
For us, there definitely were, and it came down a lot to the cost. There was one company, and I can't remember off the top of my head what that is. I could probably find out for you. Initially the package seemed really, very good with their cost, but then it became more prohibited once we found out that each vehicle needed a separate license. So, if we had 10 vehicles, usually the packages, they come in packages. So it's 1 to 7 licenses, and then it goes from 7 to, 15, and there's no real in between. So you have to buy these big globs of packages in order for them to give you those licenses. So that was kind of a big eye opener for us. And then a lot of people, the company that we went with really gave us a break on the annual maintenance fees to begin with for the next few years, just because they wanted us to get the word out, about how the program was working and that sort of thing. So I think there's a lot of wiggle room when you're working with these companies to really negotiate with them in terms of the cost and what it is you're trying to do. And again, make sure that you're communicating to them what it is that you're looking for this program to do, because we've talked to other agencies who are trying to implement the same thing we did and went with other software companies and found out that it just wasn't possible. So it was kind of not a waste of money, because obviously they can still use it, but it wasn't up to what they had originally thought their program could be built to be.
I mean, I would say, so I'm actually really interested in the whole idea of microtransit. I mean, the town next to us, just implemented a program with VIA that we've been, for their older adult population, that we've sort of been, curious about and looking at. I think for us, we really wanted to, we wanted something that would emulate what folks had with our taxi discount program, which was, they could request a ride whenever they wanted it. They could go wherever they wanted to, generally. And I think we sort of wanted to emulate that when we were thinking about, implementing a new program. And so that's sort of why we made the choice that we made. And we also, we received a pilot grant. And so I think that's the other sort of the other significant piece of it, is that, we wanted to try something, and we received funding for that. And so, have been moving forward with that.
Yeah, and I would just say too that for us, because we did receive that discretionary grant, we probably wouldn't have made this decision without that, only because our funding is so limited. So we probably wouldn't have taken that next step to try this microtransit had it not been for a grant opportunity like this to come along. So now that we know more about it, we're going to try to find ways to incorporate it into our regular service once the grant has ended. But it's probably, just because we're a little bit more on the cautious side, probably not something we would have jumped into had it not been for a grant opportunity.
I don't really have much else to add besides we looked at Lyft and Uber and went with Lyft. So.
Thank you. And we did have a hand raised, but it looks like it was taken down. So if you still want to ask your question, please go ahead and raise your hand and we'll get back to you. So Cheryl, please go ahead and ask your question.
I was just wondering if you happen to try personal care support specialist companies for medical appointments for transportation.
Is that to me?
Yes, it could be to you, yes.
Personal care specialist.
Personal care specialist companies?
What would that look like?
Well, personal care specialists actually help people with maybe having breakfast or lunch.
So we don't have that option in Maine.
Well, I actually worked for one, I forget the name of it, up in Plymouth, Maine, which is very rural. And I had 3 people that I did take care of at one point. And I did, as part of the company, I did get paid to take them to medical appointments.
So yeah, okay. So I have some patients that have some personal care. I have one of them that I am actually trying to arrange transportation. There's just people aren't taking those jobs down here. I don't know about up there, but I've had many people that have not successfully kept any kind of personal care attendance. In staffing, there's like a huge turnover. And that for one patient who I have brainstormed a lot with, I think, a couple of members on this call about who she's a blind individual who can't use a lot of these services. She's gone through so many different people and just hasn't kept staffing for that. And a lot of our patients just don't qualify or don't have that option. But overall, I've seen that it's extremely hard to qualify and to keep somebody on staff for that. So it's been very limited.
Okay.
We have another question from the audience. This one is from Sylvia. Go ahead, Sylvia.
Hi, thanks so much. So impressed with all these programs, and it's my mind is reeling. I had several questions actually in the chat box, so I'll start with the first one. With all these programs, I'm wondering if you've been able to coordinate with family caregivers to be part of what I'm calling the team in assisting the older adults. Yeah, so just wondering.
I can answer that pretty easily, where a lot of our patients are isolated, might not have family involved. And so I have a lot of people that just don't have any support. And so it's easier if they do have somebody in the home that could help support them and go, coordinate some of this stuff and do that. But a significant portion of our population is pretty isolated.
And I would just say that, what we try to encourage is that folks utilize all the options that are available to them. So if they have a friend that can take them, one day, great. Maybe they can rely on the GoGo program one day. And then, I always encourage folks to use the paratransit system here. So, I think it's a matter of sort of seeing it as what are the options that are sort of available to you, and then piecing together the system that works. Because obviously our program doesn't cover everything for folks. And so, I think seeking out alternatives is really important, and that can come from friends or family support as well.
And for us, we work with a lot of the local nursing homes, the rest homes. We communicate regularly with social service agencies, making sure that they're aware of our program. So we do have a lot of things set up in place. And with our demand response system, if some of our elderly or veterans or people that are disabled and need a little extra hand, they're able to bring an additional person with them at no cost to help, whether it's with groceries or bringing a wheelchair into a medical facility. So we do have those things set up in place, and that has seemed to work. Not necessarily for the microtransit, but again, with the other program that we operate within our demand response, there definitely is a need for somebody to have assistance more times than not.
Thank you all. We have one last question. And it's moving towards thinking about, the future and sustainability. A lot of you are funded through grants. What does it look like moving forward after your grant ends? Are there other sources of funding that you are looking into?
For us, we're hoping, one of the things with the discretionary grant that we received funding on was they wanted us to create a program that would be sustainable so that it could hold its own once the grant funding did go away. And again, the pandemic just threw a big, wrench into everything for many of us. And we're hoping that as things kind of go back to whatever normal, it's going to go back to that, we're going to build up enough of the ridership where some of the revenues can offset that and still, get assistance maybe from local organizations. Maybe some of the banks or grocery stores would be willing to make a donation to offset some of the costs for these programs. So there's a few things that we have in mind. We have a couple of years to think about that and to see what direction it's going to head into, but we're pretty confident that we'll be able to at least keep some aspect of the microtransit around, only because our drivers are being paid to be on the road and drive vehicles regardless, you know, because they're there for the demand response in our ADA trips. So if they're out on the road and it's a slow day and a microtransit trip comes in, it's not costing us anything extra to perform that trip because we already have people in place to do that. So we're hoping that model can continue. I'm not sure about the weekend service because that is something brand new to us, and we've had to hire, you know, a road supervisor, managers, and additional staff to be there on days where normally we wouldn't operate.
So we were initially funded under a grant, but then moved over to being funded under this like PNC tax that comes back to the municipality. But obviously that is going to be a challenge given the fact that the revenue from that is going to be significantly decreased, and we don't actually know yet how much that will be decreased. But so, you know, I think that is going to be a challenge moving forward.
Was the question about grants? Or was it?
Yes, grants and sustainability moving forward.
Oh,
so
so, yeah.
funding.
We are grant funded. It's supposed to be for 2 years. I don't know kind of where we're at with all of that. We can always apply for grants out, you know, more grants as need be potentially and get them. We'll see. But we also do have some donated funds that we utilize, especially for taxis, to offset some of those costs. We never let a patient have a barrier with transportation when it comes to getting their care. So we figure it out and we make it happen. So I don't know if Lyft would be sustainable for the future, but we'll always be doing something.
Great, thank you all so much. I hate to end the conversation short because I know we still have a lot of questions that are left in the Q&A and in the chat, and folks have their hand raised. So I'm sorry if we weren't able to get to you, but you can see on the screen right now, we have the contact information for our presenters today. So if your question didn't get answered or something else comes up, please don't hesitate to reach out to them. And thank you to our presenters for being available today, providing this information, and being available to answer these future questions. Just a reminder to please take our evaluation. The link is on the screen and it's also in the chat box. We will be following up with a recording of today's presentation and the slides. So please stay on the lookout for that in your inbox. And otherwise, thank you to everyone for all the great work you're doing. And also please stay on the lookout for more webinars through our collaboration. So thanks everybody and have a great afternoon.
Thank you.